We have human resources procedures that we have trouble influencing. How we train staff many times is orienting staff to a new way of work. It's not skill-based training. It doesn't involve the ability to practice to a set of criteria. It doesn't involve a pre-post assessment. When we talk about coaching, many times that becomes just another thing a supervisor has to do, and it doesn't involve direct observation. It doesn't involve the use of multiple data sources to provide feedback. It's not integrated into performance assessments. It's not based on coaching for competency. There's not a coaching system that's been developed to ensure that supervisors and coaches have the resources they need to do the way of work. When we talk about fidelity assessments, many times they're just looking at content fidelity. Did something happen or did it not happen? We're not looking at quality. When we talk about decision support data systems, many times we're talking about collecting data, but not using data. We're very, very, very good at collecting data. Lots of it. But the idea that we would collect it, that it would be relevant, that it would be actionable, that people would be accountable, that there'd be processes in place to move information up and down a system, these are the things that are typically missing from that driver. Facilitated administration. For most evidence-based models, leadership is involved at the readiness phase. So they come on board, they sign off, and they say, yes, we want to do this model, and then they're never seen again. And then the kind of policies and procedures that need to be changed to support the new way of work don't happen. Systems interventions. We have collaborative partnerships, but maybe those collaborative partnerships aren't in service to the new way of work. We have not been able to affect policy in the way that we would want. We don't have good policy to practice feedback loops. So do all of these things happen all the time? No. Lots of times, these drivers, we do a great job of installing some of them. But what I'm trying to do is walk through what the typical challenges around each of these things are. And that many times we don't know what we don't know. And so we think that we are hiring and training and coaching, but we're not using the best practices that the literature would say are needed so that we can support high fidelity uptake of the intervention. And we don't look at it from a systems perspective. I'm going to save leadership for a little bit later in the talk. I'm going to and give a little discussion around what we're thinking about leadership as we move forward. But there's no question it's important. One of the challenges is it's probably the least studied piece of implementation. Everyone says leadership's important. And we have lots of models of leadership, transformational leadership, adaptive leadership, civic leadership. But we don't really know exactly what it takes to create leaders that support evidence-based models in practice. I have some colleagues doing work on that now, and it can't come quick enough for us to start to look closely at that. So we talked about stages, we talked about drivers. The last piece is improvement cycles, which is really embedded in the stages and drivers work. So we know that new practices do not fare well in existing organizational structures and systems, kind of have the tyranny of the status quo. It's very, very hard to change systems to support new ways of work. And there's real reasons why that's hard. Because we can't stop and retool. It's not like we can stop serving families and say we're just going to hold off for 6 months and get our ducks in a row. That doesn't happen. So there's a lot of concurrent planning that's going on when we try and bring in new practice models. Outcomes are unpredictable, and we really don't know what to do every step of the way. So we institute several different improvement cycles in the work that we do on site, all of which come from the concept of the Plan, Do, Study, Act cycle, which has been around a very, very long time. And when we think about these improvement cycles and using PDSAs, we're looking at doing usability testing during initial implementation, assessing the feasibility of those early occurring components of the model, doing rapid cycle problem solving so we can make quick adjustments when necessary, and then instituting PDSAs in slow motion, which I think would be policy practice feedback loops, things that take longer periods of time to happen, but need to be put in place. Last night at dinner, I mentioned an article by Greg Ahrens. It's an implementation science journal, The Dynamic Adaptation Process. I really like that article because it talks so nicely and concisely about change on purpose. And that most change that we make in practice for any model that we intend to implement, evidence-based model, innovation, practice model, whatever it is, most of those changes are either reactionary or opportunistic. They're not done on purpose and they're not studied. We don't have rapid feedback loops and evaluation loops that allow us to know what adjustments we're making, what effect they're having. So I like Greg Ahrens' article because it walks through a conceptual framework for a dynamic adaptation process, but it's also the context within which he's talking is child welfare. So it's a really nice, I think there's a line in there that talks about, models don't necessarily get replicated, they get translated. And I think the fact that he brings that to the forefront and then talks about how we can do that purposefully, data-driven, with quality, I think it's a really nice piece, so I recommend it. But we focus on using data, all forms of data, as we move through each stage of implementation. So then who makes change happen? So I said this is kind of an area of interest of mine. I was transparent about that. This is an area that I have great interest in, which is in how do we develop implementation capacity at local levels, jurisdictional levels, so that administrators and practitioners can be good consumers of evidence and good implementers of evidence. So I'll talk about the idea of creating implementation teams and thinking of them also as adaptive problem-solving units, because most of the challenges that we're trying to address, specifically in the fields that I spend a lot of my time in, which is early childhood and child welfare, are very complex. And the initiatives that are put in place to address those challenges are also complex. And so it's not a lot of times a single intervention. It's a practice model, a set of practices, a cadre of interventions that's being used. So it's really important that we're building the capacity at the local level for folks to understand implementation generally and not just for specific innovations. Not that that's not critical, but there's also a general competency that I think is important to be building in the field. So we talk about implementation teams. Their focus is on quality, integration, and sustainability of those implementation drivers. So that implementation framework, the drivers, is something that we take through every stage, and we build the competency of teams to be fluent with. Not that it matters that they can name each driver, like take a test on it, but it's the idea that there's a deep understanding of infrastructure changes that have to happen to support evidence and practice. That they can do good database decision making. I know we have individuals in the room today that are very focused on building practitioner and administrators' ability to use data dashboards. I think that's just such an important part of the field. Problem solving and analytical engagement and purposeful adaptation, alignment and sustainability, and they provide the accountable structure for implementation for any new innovation. I say this because there's a lot of focus on implementation teams, and there's some really good research going on, and some models around teaming that have been shown to be efficient, so reduce time to implementation, and have good fidelity implementation. But most of those models are innovation specific. So we're building a jurisdiction's capacity to be experts around a certain model. And I think in the world that we live in now, I think it's important that we also build, again, general competency as models kind of move in and out, that they can do that kind of work. So we've been kind of playing around with it. So what is it that we think from the research, as well as from our last 10 years in the field, taking these implementation frameworks into practice, really seem to matter in terms of a skill set, a set of competencies for teams. Team structure, so that teams know how to structure themselves. So depending upon the size and scope of the initiative, that they would understand what sort of linked teaming structure needs to be in place throughout the system to support the new way of work. That there needs to be fluency with the intervention. That there needs to be fluency with implementation methods. There needs to be a deep understanding of improvement cycles and how to apply them and use data. And an understanding around systems change components. And I'm going to go into a little more depth about this in a moment. But these 5 areas are areas that we have been focusing on a lot on the ground with teams that we're forming at state and county levels to do this work. That we work with teams not only to move through the stages of implementation and make decisions around interventions, but we're also always building their competency and capacity around these 5 domains, so that we can exit that system and know that we've left behind a legacy of individuals that have fluency in these competencies and an ability to make good choices for their service system as they move forward. Now, these are big dreams. So I'm going to give one example of how we've had some success. But it takes a lot of time to be able to do this kind of work. So I'll be able to talk about a 5-year project where I feel like we've been able to accomplish this. So how do we build the capacity of teams to do the work? So how do we ensure that innovations achieve their full potential in a local context? How can we expand the leadership base so more individuals are coming to the table in a service system as not just champions, we hear that word a lot, champions, implementation. How can we build their ability to be good, adaptive, problem-solving thinkers? How do we do that work? Well, we know that building capacity requires more than just forming the teams. We need new ways of work, new ways to organize and address complex problems, new ways to talk about the issues, to make decisions, and to relate to one another. So we know this. And so, because we know this, I'm going to go back to that leadership piece I said earlier in the triangle that was at the base that we would revisit later. If we think about those 5 competencies, knowing how to structure your team, intervention and implementation fluency, systems work, and improvement cycles, we're actively working to build those competencies, but we also need to be building leadership skills. If you look across, one thing we do know about the models that are out there for leadership, transformational leadership, adaptive leadership, they all de-emphasize the individual. They all emphasize the collective in some way. That's a broad statement. But if you look at that literature, there is an emphasis on collective leadership. One of the frameworks that I feel really summarizes or synthesizes across these frameworks quite well is a framework developed by the Kansas Leadership Center. And it's a civic leadership model. But it does a really nice job of describing when we work with implementation teams, we bring people together at a state level, at a county level in the work that we're doing, whether it's child welfare, early childhood, education, special education, doing this work kind of across the country and bringing people together. We're not just building their competencies related to those 5 domains, we're also focused on building their leadership. We know that team members need to be good diagnosticians. They need to be able to distinguish technical challenges from adaptive challenges. They need to understand legitimate yet competing perspectives. They need to test multiple interpretations and points of view. So if a service system faces a challenge, We need to build the leadership capacity of individuals in that service system to be able to be good diagnosticians of the type of challenge they face and the multiple points of view that are in place to address that challenge. We know that team members need to be able to manage themselves. They need to have comfort with uncertainty and conflict. They need to be able to experiment beyond their comfort zone, understand their own personal strengths and challenges. So when we're working with teams and building their competencies, we're also doing a lot of activities to bring out these leadership competencies as well. So you can imagine what they look like. Effective praise, motivational interviewing. I mean, there's all sorts of things that we're using on the spot with teams as we work with them over months and years to start to build these leadership competencies. They need to be able to intervene skillfully, so team members need to be able to make conscious choices and give the work back. That's a big piece of adaptive leadership, to give the work back to the people when needed to get good consensus. To energize others, to energize non-traditional voices, to work across service sectors, to inspire collective process. So if we work on these leadership pieces, we know that without appropriate training, guidance, and encouragement, emerging leaders grow frustrated and they step back into comfortable territory. So while we're building these leadership capacities with implementation teams that are formed, and these teams, whether at state level or county level, should represent the system as is. So all teams will have, every team that I've ever worked with has practitioners, supervisors, administrators. They represent the system as is, and sometimes there are multiple teams. And we're working very hard to build their leadership capacity and their competencies.